We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Before we begin today's episode, let's hear from this week's sponsor.
You know, almost nobody gets personal finance training in medical school or dental school. When you get out of training, you're saddled with hundreds of thousands of dollars in debt right out of the gate. So it's no wonder that physician burnout is such a problem. And that problem isn't limited to just the physician. That kind of financial stress affects your family life because it constrains your finances and it prevents you from reaching your financial goals. As a result, your marriage may be strained and stressed as well. Well, that's why I'm so excited to tell you about the Marriage and Money MD Summit coming up on November 15th through 17th. It's a free summit for healthcare professionals who want to build a stronger marriage and create a better path to building wealth. You'll hear from 21 amazing speakers over 3 days, and you'll come away with the tools and resources you need to have the happy family life and the path to financial independence that you deserve. You can sign up today by clicking the link in the podcast description. Even if you don't get a chance to attend the talks live, sign up for free anyway, and you can catch the replays for the rest of the week. Again, click the link in the podcast description to sign up for free. I can't wait to see you there.
So welcome everybody to this week's podcast episode for Financial Freedom for Physicians. And I'm your host, Dr. Christopher Liu. And as you know, we promote several types of freedom for our podcast. The first is financial freedom. Second is location, emotional, and last is time freedom. So, I bring guests on that encompass a lot of the different types of freedom that are living their lives in new and innovative and creative ways. So today we have a very special guest, Dr. Olapeju Simoyan, and I'm going to read her bio. So she's a medical director of research at Caron Treatment Center and a professor in the Department of Psychiatry at Drexel University College of Medicine. Prior to her current position, she was the Associate Medical Director at Geisinger Marworth Treatment Center in Waverly and the Program Director of Geisinger's Addiction Medicine Fellowship. She also held the rank of Associate Professor of Family Medicine and Epidemiology at the Geisinger Commonwealth School of Medicine. So she got her MD from Penn State. Then she did her internship in psychiatry, family medicine at Pittsburgh. And she completed her family medicine residency at the Penn State Good Samaritan Hospital Family Medicine Residency Program. So she's also had received dental degrees from the University of Ibadan in Nigeria, and she also holds a Master of Public Health degree from Johns Hopkins University. Board certified family medicine, addiction medicine, and dental public health, and has contributed to international public health education as a Fulbright specialist in Nigeria. And she is a Erasmus Mundus scholar in France and the UK. And she also volunteers on medical mission projects in Nigeria and Haiti. So she's also serves on the editorial board of Medical Education Online and is the founding editor-in-chief of Black Diamonds, a literary journal. She's also a member of the AMWA, and also she's also curated a photographic exhibit featuring prominent women in medicine. So today we're going to be talking about artistry and music. So she's very active in these fields. So she strongly believes in the need to transform the way we educate children and youth with a focus on creativity, problem solving, and integrating arts and sciences. So she's also received several scholarships and awards as the Emerging Leader Award from Family Medicine Education Consortium. She's also AMC Herbert Nickens Faculty Fellowship, and she was recognized by Northeastern Pennsylvania Business Journal as one of the top 25 women in business in 2015 and was a second prize winner in the State Department's Citizen Diplomacy Challenge in the same year. So our guest today is very accomplished, and she's going to talk all about how art and music has combined to enrich her lives and the lives of others. So, Peju, welcome
Yes,
to the show.
thank you. Thank you.
We're so glad to have you. I've your bio is so accomplished. So
Thank you.
behind all of those accolades, I'm really interested in learning the person behind the bio. So tell us all about, you know, you where you grew up, your training, all of your influences, and how that led you to pursue a passion for the arts and creative endeavors.
Okay, I should probably ask how much time we have. You really want to hear everything? Anyway, let's see. Let's see. So actually, I grew up in Nigeria, but I was actually born in Washington, D.C. I was born into a diplomatic family. So we were born in different countries. But, you know, I ended up growing up mostly in Nigeria. And I had a lot of interests growing up, you know, but definitely grew up in an environment where, you know, you were expected to become a doctor or a lawyer, or, you know, and yeah, there was a lot of pressure, to say the least. And I remember once telling a relative, it wasn't even my parents, it was a relative. I told her that, you know, she asked what I wanted to be when I grew up, and I said I wanted to be a pianist. And she just gave me this look like, you know, you better think about a real job. That's a hobby. you know, you know? And, yeah. And I remember when I was a little bit older, telling my parents that I liked writing. I'm not even sure. I didn't even do that much writing, but I just knew that there was something in me that wanted to write. I really wanted to write. And I remember telling them, and then, oh, you can do that in your spare time. So, yeah. So I was expected to become a doctor, but inside me, I knew that I wanted to do a lot of other things too. So, and then the system in Nigeria, you didn't have to, it wasn't like here where you do 4 years of college and then go to medical or dental school. It was like you make up your mind in high school and then you go right into university. So, so I remember thinking that, well, dentistry is kind of, it's like close enough to medicine. I'll still learn a lot about, you know, the anatomy and the physiology and all these interesting things, you know, but I'll eventually have time to pursue other interests. That was kind of my thinking. You know, I didn't really have a whole lot of career guidance at the time. And believe it or not, I was 15. I was 15 when I entered university, and literally 6 years later, I was a dentist. So, yeah. So I did that. And then, you know, but again, there was a part of me, I knew I had all these other interests, but at the same time, I kind of felt responsible for saving the world. So, and I sort of had an interest in public health without really understanding what public health was.
Yeah.
So, yeah. So, after, you know, doing some dentistry for a while, I heard about this MPH program, Master of Public Health program at Johns Hopkins. And, you know, and I heard that, you know, if you get an MPH from Hopkins, there's a job waiting for you and that sort of thing. And I was like, yeah, I'll get an MPH from Hopkins and I'll go save the world, you know, maybe go work with the WHO or UNICEF or, yeah. So, you know, I ended up applying to Hopkins and getting accepted, and I got through the MPH, and guess what? That wonderful job wasn't waiting for me, you know? Yeah, so yeah, but I did have other opportunities because I had the dental training. I was able to get into a dental public health residency program. So I did that and then stayed on there. That was in New York at Montefiore. I stayed on for a while. And then, you know, it's like more and more, I kept feeling like I really needed to do more, you know, and I was feeling very, very limited, you know. And so eventually I decided to apply to medical school, and I went to medical school. Now, what happened to my music and my interest in writing and all that? Well, let's see. So I went to medical school. Fortunately, I went to Penn State Hershey that has a very strong medical humanities program. So there, we at least in the first year, we did a lot of writing. You know, we wrote about we had these, during the course, we had these writing assignments. So we would write about things like spirituality in medicine, death and dying, caring for the poor and that sort of thing. And so that gave me an opportunity to do some writing, but it wasn't really a consistent thing, and then with the piano, I hadn't really had lessons. I only had lessons for a very, very brief period as a child. Most of it I was just doing on my own when I could. So, in medical school, there's not a whole lot of time for that either, but I would, play when I could. And once in a while, I would help to organize musical events, like around the holidays, Christmas time, and we would have talent shows and, people would perform and sometimes I would sing. I never really thought my piano playing was good enough to perform anyway, but, but other people had the opportunity to perform. Yeah, and sometimes I would sing in groups, and I started teaching myself the guitar. Actually, before I went to medical school, when I finished my MPH, between then and my starting my the public health residency in New York, I was staying with friends for a few months, and there was a guitar in the house and nobody played. So I picked it up and I started teaching myself chords. And then I realized that, it's not really that hard. All you have to do is play a few chords and you can accompany a lot of songs. So that's how I started playing the guitar, right? So in medical school, I would play the piano and guitar, but again, I didn't really spend a whole lot of time on those. And then I, finished medical school, did my residency, like you had mentioned. I started in Pittsburgh and then I came back to Penn State to finish my family medicine residency. And it was during my my first faculty position, actually, after residency, when I went to Scranton, Pennsylvania to be part of a new medical school. It was then called the Commonwealth Medical College. Now it's Geisinger Marworth School of Medicine. And so here I was in my first faculty position, all these responsibilities at a new medical school. And but then again, because I had all these interests, they kind of never went away. So again, we would have opportunities for, talent shows for the students. Sometimes I would participate. As a medical student at Hershey, I was part of, I was on the editorial team for a literary journal called Wild Onions. And as a fourth year medical student, I was the editor. It was actually a student-run initiative and it had been going on for years. So when I got to Scranton, I thought, after settling down, I thought it would be a nice idea to do something similar. So got together with the students and we started something called Black Diamonds, a literary magazine. And, and I was the editor and I did that till I left. Actually, even last year after I left, I still worked on the last edition, the last issue. So, but it really was an opportunity for students, staff, faculty members to share their, to share their artwork, their poetry, their photography, to write about patients' experiences, write about life. It was it was very time consuming, but at the same time, when you're doing something that you really enjoy, then, it doesn't feel like work. Sometimes it does, but, there's a bigger purpose behind it, I think. Yeah. And then it was during my time in Scranton that I picked up the ukulele as well, and I had always liked the idea of, singing in groups and doing things in the, like maybe going out to nursing homes and singing. And I hadn't had the opportunity to do that before, but then somebody started a ukulele group, so I joined that. And then we would sometimes go to nursing homes and sing at different events during the holidays. And and then so it's been, one thing leading to another. And then in the last week or two, I recorded myself singing the national anthem, actually both the Nigerian and the US national anthems for a conference that's starting this week, and in the past, I never would have thought, I never would have been bold enough to do something like that. But it's just that I've always felt like, I need to keep finding ways of expressing myself artistically. It's something it just doesn't go away. When you have a passion for something, you keep looking for those outlets and ways of expressing and, and sharing sharing those interests, sharing those talents. I hesitated to even talk about talent because I didn't really consider myself talented at all. To me, if I was musically talented, I'd really be a lot better. I like to think that I just enjoy it. I just enjoy it, So yeah, it's been an interesting road, but I just I finally have come to the point where I realized, okay, it's okay to have all these interests. It's okay and still be a doctor. It doesn't make me abnormal. It's just, there's a reason our left and right brain are connected. There's a reason the corpus callosum exists, right? Right? Because the left and right brain are supposed to work together. I don't really believe in the dichotomy between left brain and right brain. I think that we could do a lot more if we allowed ourselves to be creative, to express our creativity, to bring our creativity even into medicine and to healthcare and to the way we interact with our patients as well. So I think I'll stop here for now.
You brought up so many good points, because I remember all of those points, like they say, what's your major in college, and then you're expected to major in something that will give you a professional skill, so that you can, and it's interesting just because of the way we're programmed, but like things such as arts and humanity, literature, music are sort of put on the side because you can't, because you really have to have a strong talent in order to really make a living out of it. So, but you also brought a lot of good points, because in medical school, luckily we also had a class where it was like a Friday lunch, and we'd have people speak about ethics and death and dying, and so that was really but a lot of medical schools don't have that. So what do you think about how medical schools can start incorporating creativity into their curriculum, and what are the benefits of doing that?
So I think it's so important. And so, like I mentioned, Penn State has a strong program. I actually think that medical schools are starting to do, or a number of medical schools are starting to incorporate the humanities into their curriculum. I think that actually it's at the graduate medical education level that there's it's been much more of a challenge. And I'm actually part of an initiative here within the Reading Hospital Tower Health System to incorporate, to develop a medical humanities curriculum, because again, we've recognized that it's really important, to talk about all these things, whether or not they had any of it in medical school. They need to keep, it's something we need to keep bringing up in their education, medical ethics, professionalism, so there's one aspect is the didactic aspect, the theoretical aspect, how do you deal with, ethical dilemmas, and how do you comport yourself, professionally and all that. But then the other aspect is, how can we use the arts to improve the way we provide healthcare, right? How can we maybe incorporate music therapy into what we do? How can we use the arts for our own well-being, to maintain balance in our own lives, So there's so many different facets, and I think that, it's important for us to realize that, these things are important, and it's not just, they're not just extras. It's not just, touchy-feely stuff. These things really matter. It's important to learn about the history of medicine. It's important to learn about, things that happened in the past, ethical issues, that, things about, we talk about, the Tuskegee studies and stuff like, things like that, so that we don't repeat those mistakes of the past. If we don't talk about them, how will we know that we shouldn't do that in the future? How we know how to prevent things like that from happening in the future? So I think that I think more and more people are beginning to understand and appreciate the importance of the humanities in medical education. Again, how to enforce it and how to implement it, especially at the graduate medical education level, is a challenge, but hopefully, I think that there are ways to do it. It's more challenging because the curriculum isn't as structured as the medical students' curriculum, and residents they're physicians, they're working, they're busy. But I think that if we recognize that it's important enough, then we'll make the time for it, And so it's going to involve a lot of buy-in from leadership and from the trainees themselves, but hopefully they'll come around and realize the importance and, participate.
Yeah. You brought up a lot of good points because, right now, if, physicians, whether for their own well-being or for patients' well-being, they have to learn all of these outside of the curriculum. So it's very interesting that there's physicians such as yourself leading initiatives to start incorporating humanities into the curriculum, making providers more aware of a lot of social issues as not only for themselves, but also for the benefits and care of the patients. So
exactly.
Yeah. Yeah.
And then
Go ahead.
Sorry, the other thing that I forgot to mention is that this is another aspect, another reason why I think it's important to encourage people who have to encourage people who are interested in medicine and healthcare to not forget about their musical interests or their artistic interests, or to actually encourage people who have those abilities to go into healthcare if they, if they're so inclined. So let me give some specific examples. If a person is musically trained, now I learned music, I like to say I learned it in a very haphazard way, but for people who are properly trained in music, the level of ear training you have is significant, and that can have an impact when you're providing patient care and you're learning to listen to the heart sounds, and you're learning to, listen to what does a murmur sound like, it can really make a significant difference, if you if your vision is developed so well as an artist that you can appreciate, very minor differences in color, in color and texture when you're examining artwork, that might translate into your ability to read radiographs, to pick up, very subtle changes on an MRI and that sort of thing. And these are things that I don't think we've explored well enough, but I think that there's so much potential there, and we really need to, I think we could do a better job of, again, bringing the arts and the sciences together.
Yeah, that's interesting. That's you brought up very interesting points of using ear and then your different five senses to make you a better physician,
Yes.
So that's actually quite interesting. So well, you brought up so many points, and I know you recently you had a YouTube upload with your work as well. So you want to tell us more about that?
So which one are you talking about now? I've had a couple.
Other one. the one. For the listeners, how can they go and look at your work and follow?
Oh, okay. Okay, thank you. So yeah. So personally, I have a website that's just thedoctorwriter.com. It's all one word. Okay. And some of my work is there, and then there are links to various things that I've done, and links to some of my my photo books. I found a way of combining my interest in writing with my interest in photography, and so I have two photo books. One is Scranton, a place to call home, and so I took pictures of places in and around Scranton, and had little bits and pieces of historical information in there, and that was for the 150th anniversary of Scranton, which was in 2016. So I moved away from Scranton last year, right about the time the pandemic was starting, and I now live in Reading, Pennsylvania. But I also have another photo book about butterflies. So it has my butterfly photography, and then again, pieces of information about the different butterfly species and their life cycles and all that. And that's available on Amazon, but there are links, there's a link on my website as well. If you want to find out about my professional work, that's I work at Caron Treatment Center. That's CARON. So if you go to caron.org, you can read more about the research that we're doing related to addiction medicine. That's a whole other, a whole other area. Yeah.
Wow.
Yeah.
Yeah. Well, for all of the viewers and all of the resources given by Peju will be put in the show notes. So
Okay,
as well as your website as well. So
thank you so much.
So as we conclude, what is your final words for listeners? What do you want them to be the biggest takeaway message, words of inspiration, motivation? I leave it to you.
Oh, well, don't limit yourself. Don't limit yourself. If you want to be a doctor, but that doesn't mean that you can't be an artist. It doesn't mean that you can't be a musician. I finally got to the point. I used to feel as if there was something wrong with me, and I finally got to the point where I'm comfortable with just being who I was created to be, I finally realized that I can be a physician scientist and a physician artist at the same time. It's a matter of it's just a matter of finding out what works. Sometimes you'll have to put some things on hold, and focus on one thing at a time, one or two things at a time. You can't do everything at the same time. But yeah, it is possible to, to have multiple interests, and to excel in different areas. And it doesn't make us abnormal, but yeah, so I would encourage people to just, like I say, stop trying to be normal and just be the superstar you were created to be.
Well, those are fantastic words of advice. So
thank you.
Thanks so much for coming onto the show.
You're welcome.
We look forward to having you back in the future.
Okay, thank you so much, Chris. My pleasure. Thank you.
Come join us at the Marriage and Money MD Summit coming up on November 15th through 17th. It's a free summit for healthcare professionals who want to build a stronger marriage and create a better path to building wealth. Click the link in the podcast description to sign up for free and come away with the tools and resources you need to have the happy family life and path to financial independence that you deserve.
I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislewmdphd.com for more support. I'll see you next week.